here with Dr. Durland Fish, the Professor Emeritus of Public Health at the Yale School of Public Health. And we're talking about what everyone's talking about, COVID-19, the coronavirus. And we're doing this interview through the miracle of Skype because being in person isn't so safe anymore. Dr. Fish, would you like to talk about the kinds of precautions you've been taking because of this virus?
Yes, I've been taking precautions for a number of years with against influenza virus, because I'm retired. I'm in my mid 70s, and my partner is in her mid 70s, and she has a chronic lung disease, and she would have a serious problem with something even like influenza. So I've been taking precautions as a matter of just of habit to try to prevent, acquiring influenza, and I think that these same precautions might be useful for coronavirus. Social distancing is one thing, but this virus can also be acquired from inanimate objects, like paper and railings and anything you would touch. You could have virus on it, and although we don't know how long the virus survives on inanimate objects, we know that it does survive for some period of time. Excuse me, and that all depends on, the nature of the object and the environmental conditions, humidity, heat, and everything else. But the point is that this is another route of transmission that I think is often overlooked, and so the precautions that I've developed as a matter of habit to prevent influenza, I think would be appropriate for people to follow for preventing coronavirus as well.
And you mentioned money and touching objects like doorknobs and railings. What do you do about money?
Well, I don't use money. I use credit cards exclusively, because you don't know when you're handed a dollar bill as change at a store or wherever. You don't know where that dollar's been. Somebody could have sneezed on it just moments before you got it, and it could be a route of infection. So I don't touch money at all. I do go to the bank occasionally and get crisp dollar bills and $5 bills. If I need to spend money, I know it's clean, and I can give it to somebody and not expect to get change.
Mm-hmm.
So that's one thing. And another thing is to, the first thing, which everybody knows, is to wash your hands. But it's not often stressed that this hand washing is only effective if it's done with warm water and soap, and if it's done for a minimum of 20 seconds. A lot of people just pass their hands under water and grab a paper towel and leave, and that's just a waste of paper towels. And so every opportunity that anyone gets to be at a sink where they can wash their hands, where there's soap, they should definitely do that as often as possible. And people, you see etiquette in restrooms. I think a lot of times people just go through the motions of washing their hands so they look polite and sanitary, even though it's not very effective for doing anything. But I think people, you should stare at people if they don't wash their hands for 20 seconds. They should be stared at, and not the person who doesn't wash their hands and walks out of the restroom. So,
and then also, I think a lot of people are using that hand towel to then open the door in a public place, right? Instead of throwing it away and then using your hand to open the door.
That's true, and that's true for turning off the faucet if the faucet needs to be turned off and things like that. And speaking of doorknobs, I try to avoid touching any kind of a doorknob. I just try to avoid it. If I can open a door with my foot or my elbow or some other, I'll do it. But if I have to touch a doorknob, it would be with my left hand. I'm right-handed. And if I had to touch a doorknob, it would be on my left hand. I keep thinking about when I see a doorknob outside of a building, especially a public building where people are constantly going in and out. I just, especially in the wintertime, I think frozen snot. I don't
Great.
want to touch. I don't want to touch it.
That's an image I don't want to see, but I think I'm not going to be able to unsee it now. And you also
Well,
you mentioned hand railings as well.
yeah, hand railings. I mean, people often, and I used to do this, just, walking down the steps, you slide your hand down the rail. Well, gee, you don't know if anyone sneezed on that rail or sneezed on their hand before they touched the rail. And sliding your hand down the rail is just accumulating, who knows what. So I don't use rails unless I'm ready to fall. Uh,
Hmm.
so that's just a kind of a habit that people have that is
Hmm.
easily broken. I mean, all of these little things that I've done over the years are habits with me now, and I don't even think about doing these things. I just do them automatically. So
Hmm.
another thing is to pushing buttons, elevator buttons, and other kinds of
Hmm.
car buttons. I just touch them with a knuckle. Usually my little finger, a left hand knuckle, which it has least likely to come in contact with my face, and so I would never touch an elevator button with my finger.
Mm. I was
And
going to bring. I was going to ask you about elevator buttons. I've heard about that.
yeah, yeah. I mean, you just have to think about, all right, what has anybody else touched, and
Hmm.
try to avoid that. I mean, pens are one thing too. It's ridiculous. You go to a pharmacy and get a prescription or something, and you have to sign for the prescription, and then you have to sign the credit card slip for paying for it. And many of these pharmacies have an attached pen to the little machine. I mean, sick people go to pharmacies, and everyone's using the same pen, and so you don't do that. I either carry my own pen, or if electronic signature is required, I use my fingernail. Again, I left the small fingernail, and just, usually you can touch something and it'll work, or you could just scribble a signature on there and you won't have to touch a pen.
Hmm. How about our cell phones? I've heard that they're not so clean, but even
Well,
though other people aren't necessarily touching them.
right. Well, I don't know. I mean, yeah, I don't let anybody else use my cell phones. So I don't worry about that, too much. I mean,
Okay.
there are other things you can do, but these are ones that I do automatically. I don't even think about them.
Hmm.
So another
Hmm.
one, another one is if someone sneezes around me, I'll just immediately hold my breath. As soon as I hear somebody
Hmm.
sneeze, I hold my breath and I walk as far away as I can get before before I inhale. I mean that should
Hmm.
avoid inhaling droplets or anything if you can do it quick enough.
Hmm.
And another thing I do, if you're in a line and someone behind you is coughing and sneezing, you let them in front of you. Then they won't be coughing on you. They'll be coughing on somebody else.
Of
So
course, I'll be
those,
coughing on the counter where you're going to be
right,
going
but you
through.
don't touch anything on the counter. You just don't
Right.
touch it. So these are some common precautions that, if you get in the habit of doing them, it's easy, it's free, it's easy to do, and I think it would help prevent transmission, because we don't know how much transmission goes on with these inanimate objects, but we know it can happen.
Hmm.
It can happen. There's not enough time to do experiments to find out, how much virus might be on money and all these other things, and there's all these different situations they can be under. It take a lot of time, a lot of research to figure it out. But common sense says if this stuff can survive on inanimate objects, then during an epidemic, when a lot of people are infected, you don't touch them.
Hmm. So social distancing has become the catchphrase of the day. And I think a lot of people are a lot more understanding if you hold your breath and run away when they sneeze. But how far should we take social distancing? Should we not have friends over for dinner? Should we not leave our house at all? Or obviously the bars and restaurants are all closed now, so we don't have to worry about that.
Well, I mean, I'm under self quarantine for at least 2 weeks, maybe a month. So
Hmm.
I don't go anywhere. I mean, if I have to go to the pharmacy, I take the precautions that I'm not touching anything and not signing anything. If I have to go to the store, I spend minimum time there. I go times when there are the least amount of people there. And again, I touch as few things as possible. Um, I don't, we don't have visitors come. We have friends and things, but we talk on the phone and Skype and do things like that. But I don't want to have people coming here
Hmm.
and go visit anyone else. Just for a few weeks until we find out how serious this is going to be and when the risk is going to start going down. It might take quite a while. We don't know that. But in the meantime, since we are in a high risk group, I don't want to take any chances with this. And
Hmm.
fortunately, I'm retired, so I don't have to. I don't have a job to go to or anything, so that I can just kind of stay home. Um, but people who are my age, retirement age, are probably in the same position. They don't have to go anywhere, and so they probably shouldn't. Probably just stay home.
Hmm. You say until we find out how serious this is. Do you have any feeling about how serious it's going to be, whether it's going to be a few weeks or whether it could last for months,
Well, I
or
mean,
it's hard to tell?
I'm not. Well, no one's an expert on this particular coronavirus because it's new, right? So
Right.
nobody really knows what's going on. But I would follow the worst case scenario. You have to follow the worst case scenario. You got to be prepared for the worst. And
Hmm.
the worst case scenario is that the doubling time for this virus is about 5 days. Every 5 days, the number of cases double. I mean, maybe it's six. It's 5 or 6 days. I don't know. But in China, when they were in the same state of the epidemic, they had a doubling time of 5 days. All right. I think maybe it's 6 days here, but so that's like an exponential increase. And so and without any effective controls, which we don't really know how effective our intervention is going to be in terms of social distancing and things like that. But if it's not controlled at that rate, um, we would I would expect to see 100,000 cases by May, and 3,000, 4,000 deaths in 2 months,
Hmm.
and
Nationwide.
nationwide. Yeah, and if it's not controlled at all, it could go through the population. Experts estimate that 50 to 60% of the population would have to be infected in order for herd immunity to take place, and that is in order so enough people were immune. It'd be like a vaccine. When you get infected, you develop antibodies just like you do for a vaccine. But it would take 50 to 60% of the population to slow down the transmission rate, right? So that doubling time would go down. And,
Hmm.
and so if you figure that half the population in the US is infected, okay, which would be, I don't know, 200 million people,
Hmm.
then even with a 1% fatality rate, there would be 2 million fatalities.
Hmm.
So
Wow.
that's
It's pretty
that's
scary.
that's what some epidemiologists have predicted. That it was a worst case scenario, and it could happen. I don't see why it couldn't happen. I mean, the idea
Hmm.
is to try to use these methods, social distancing, to in quarantine to try to stop the transmission rate. And that's what we're trying to do. We won't know that for weeks, perhaps months, because there's 2-week incubation period. So even if the transmission stopped today, you wouldn't see any results for 2 weeks.
Mm-hmm.
So
Okay.
this might take us a while to figure out what's going on and how long this is going to last. But you'd have to be pretty optimistic to think that this is going to be over anytime soon.
Mm-hmm. Well, we have a few questions I'd like to throw at you from our readers, one of which you just kind of, I think, pretty much answered, which was, if you do get it, does that mean you're immune from getting it again?
As far as is known, yes. I don't know how long the immunity lasts. I don't know, but from what I've read, the situation in China that infection you only get it once for a while at least.
That's true of the flu too, or at least of each particular strain?
Well, yes. The problem with flu is it keeps changing all the time. So even if you're immune to one strain, next year's strain you're not immune to. Now, I don't know what's going to happen with this coronavirus, whether it's going to act like flu virus or not. I'm not a virologist, but this is assuming that the virus doesn't change over time too.
Mm-hmm. Which is probably not likely. Probably will mutate, right?
I don't know. I don't know.
Okay. All right. So they've started testing in the state, and Yale has opened up a collection center down at Long Wharf. So who should get tested?
Well, I'm not. Again, I'm not a physician, so I don't know. I mean, obviously, people who have been exposed or people who have symptoms should be.
Mm-hmm.
I mean, the purpose of testing is to find out, how many people have this virus, and they may have symptoms, they may not have symptoms.
Mm-hmm.
I think the idea would be to get a good cross section of samples from healthy people and unhealthy people, just to find out what's the prevalence of infection. How many people are actually carrying this virus out there? Because we know that people who don't have symptoms can be infected.
Right. Okay.
So there's one,
and you're also
it's good for a diagnostic test because if you have the coronavirus, these things that are effective against influenza virus, drugs and things aren't going to work for this virus. So you'd want to get some immediate medical attention to try to prevent any future complications.
Mm-hmm. Okay.
But remember,
and I know
I'm not a physician. I'm just telling you what I've heard.
Right. Okay. And I'll understand if you want to beg off this one too, but someone asked if people should try to put off trying to get pregnant until we know what's going on with the virus.
Well, I don't know. I don't know about that. I know pregnant women that are somewhat immunocompromised. I don't know. If you had a choice, I would, probably put it off. You don't want to be sick and pregnant at the same time. So
That's true.
If you have a choice, probably delay wouldn't be a bad idea.
Mm-hmm. There's this mystery about why young children don't seem to be getting it so much.
Well, that's true. China, they had very, very few cases of people under 16. But it appears that there's evidence that they may be infected, but they just don't get symptoms and they don't get sick, or at least not very sick. I think there has been one case I've heard about of a fatality in a young person, but that seems to be rare from the Chinese experience, from what I've read. And sometimes these diseases affect young people more than they affect older people. All these diseases are different, and we're learning. We're just learning as things go along. But obviously, the older population is where the highest mortality occurs, especially people who have complicating health conditions.
Right. Well, thank you very much. I really appreciate your time and your wisdom on this, and I just wish you the best and stay well.
All right. Well, did you mention that I was with the Yale School of Public Health?
I did, but
All right.
let's say it again. This is Dr.
Yeah.
Durland Fish, a professor emeritus at the Yale School of Public Health.
Very good.
Thank you. Thank
Thank
you
you,
very
Ed.
much.
Okay, Ed.